A lot of patients assume they already know the answer. Some think they're too old, some have been missing their teeth for too long, or that they don't have enough bone. And then other patients assume because they smoke, they have diabetes, or they take certain medications that dental implants are automatically not a good option. But being a good candidate for dental implants is not always a simple yes or no answer. There are several things that we need to evaluate. So in this video, I'm going to explain what we look at, which factors can actually increase your risk, and why patients have been told that they're not candidates for dental implants. My name is Dr. Chris Bono, and I'm a dentist here at Centerville Family Dentistry and Implant Center. At our office, we focus heavily on dental implants, from replacing single teeth to full mouth treatments like All-on-4, All-on-X, fixed implant teeth. And one of the most common questions that patients ask us during an implant consultation is, do I have enough bone? Bone is important, but it is only one part of the picture. The first thing that we evaluate is your overall health. Dental implants are placed into the jawbone, so your body needs to heal around the implant and create a strong connection between the implant and the bone. And this process, fancy term, is osseointegration. Basically, the bone grows tightly around the implant and then locks it into place so it doesn't move. And for most generally healthy patients, this process is very, very predictable. Certain medications can affect healing, but that does not mean that you can't have dental implants. It may mean that we may need to take some precautions. Speak with your physicians, for example, modify the treatment plan, allow you to heal longer. And one condition that we pay close attention to is diabetes. Patients sometimes hear the word diabetes and immediately think no implants. But the bigger question is whether the diabetes is well controlled. If your blood sugar, for example, is stable and your condition is being managed, you're going to heal very well. If it's uncontrolled, your healing is going to be slower, risk of infection is higher, and the implant may have a more difficult time integrating with that bone, that connection. Also, we may review recent blood work, including your A1C levels, and communicate with your medical doctor before moving forward. Basically, the goal is not just to place an implant. The goal is to place an implant that heals properly over the long term and stays in your mouth. So we carefully review your medications. Medications can affect bone healing, the immune system, bleeding, infections, all of it. For example, some medications used to treat osteoporosis or certain cancers can affect how the jawbone heals. And some medications can suppress the immune system and also is going to affect your healing. Blood thinners, for example, don't prevent someone from getting implants, but we need to know exactly why you're taking them and how much you're taking. You should never stop a prescription medication on your own because you're planning implant surgery. You need to coordinate with us, the dentist, and then obviously your physician for the safest possible plan. And then another major factor is smoking or nicotine use. Cigarettes, vaping, chewing products, other nicotine products. Basically, you're restricting your blood flow. And restricting blood flow is making it hard for you to heal. Smoking can increase the risk of infection, bone loss, and then obviously implant failure. But does that mean smoking automatically means you can't have implants? No, but it does increase the risk. Ideally, patients should stop smoking before surgery and during the healing process. Quitting, obviously, is one of the best things that you can do for your implants and your overall health, but that's easier said than done. Next, we evaluate your gum health. Dental implants cannot develop cavities, but they can still develop inflammation, gum disease, and bone loss. The implant remains surrounded by gum tissue, right? If harmful bacteria get in that gum tissue and then cause inflammation, it's going to damage the bone, the gum tissue, and you're going to get what's called peri-implant disease. And that's going to affect the lifetime of the implant. And then that brings us to maintenance. Dental implants are not maintenance free. They still need to be brushed, they still need to be cleaned, and regular professional visits to the dentist so we can monitor the gum, the bone, the bite, all of it. A single implant may require a different flossing technique, by the way, than a natural tooth, and very different from a full arch of teeth. You're going to need a water flosser, maybe special floss, brushes, you need to clean underneath. We teach patients how to do all of this for the best long-term success and what you should be doing at home. Next, let's talk about the factor that most patients are worried about, the bone. For an implant to be stable, we need enough bone at the right location. Height, width, the density, along with where nearby structures are. Where is your nerve running? Where are the surrounding teeth? You cannot evaluate all that accurately by looking inside the mouth. This is why we use a 3D scan, a CBCT. A traditional x-ray is in 2D, but a 3D scan, we can view the entire jaw in different angles. We can measure the bone, the size, the width. We can measure how far from certain places like your nerves and your teeth, and if we need additional procedures like bone grafting. And what happens if you don't have enough bone? Well, many patients assume that means it's game over. It's not. Especially if you were told years ago. You may think it's even worse, but not always. That doesn't mean that implants are impossible. In some cases, we can rebuild the bone, meaning we can add more bone graft. If the tooth was recently removed, grafting may be placed into the hole, the socket of the tooth. If the tooth has been missing for a long time, we can widen it with bone graft. In the upper back portion of the mouth, a sinus lift may be needed to push the sinus away. Bone grafting also is not always required. Sometimes we can modify the implant size, the position, the angle. For full mouth treatments like All in X, we rarely use bone graft. We use what bone you have available, and we angle the implants in a specific way to avoid certain anatomic structures. So when someone says, I was told I don't have enough bone, we need to know when they were evaluated, what scan was taken, what treatment they were thinking of, and who the dentist was, quite frankly. Every dentist sees things differently. We also evaluate the teeth that are still present in your mouth. Some patients may assume that every remaining tooth must be saved, while others assume choosing implants means every tooth must be removed. Neither is true. You're a unique case. We examine each tooth for cavities, cracks, infections, the amount of foundation bone that you have left that's healthy. If a tooth is healthy and has a good long-term prognosis, we want to save it. If several teeth are severely infected and then you've lost a lot of bone, we may need to discuss what can we do in that sense. So everyone's different. For one patient, a single implant, like one tooth, may be the best option. For another, it may be an implant-supported bridge, multiple teeth. And then for another patient, it could be complete total tooth loss, a complete implant bridge. So there's different options. The treatment should match the actual condition of your mouth and what's actually best for you. And then your bite is another important factor. Implants are strong, but they're not indestructible. We evaluate how your upper teeth come together with your lower teeth, whether you grind or you clench your teeth, how much force is going to be placed on the implants. For example, someone with a very heavy bite or severe grinding habits, we may modify the design, or we may talk about a mouth sleep appliance, maybe even sleep apnea. There's a lot that's involved. And then people also ask us, am I too old for dental implants? Patients in their 70s and 80s and even 90s can do extremely well. Your overall health and your healing ability, medications, bone, and personal goals matter much, much more than your age. Being too young, however, can be an issue. For young patients, we usually need to wait until the jawbone is done growing before you place an implant. This is why implants are generally not placed in children whose jaws are developing. And then another part of being a good candidate is having realistic expectations. Dental implants can restore missing teeth, improve stability, make you chew better, and create a smile that looks and feels more natural. But they are still a medical and dental treatment. Healing takes time. Additional procedures may be needed. Temporary teeth can feel different from the final teeth. And then you need ongoing care. The best patients are not necessarily people with perfect mouths. They are patients who understand the process, follow instructions, and attend to follow-up visits, and they're going to get the best result. So you may be a good candidate for dental implants if you're healthy enough for a dental procedure, and your medical conditions are well controlled, and your gums are healthy, or you're willing to treat active disease, or you have enough bone, or the bone can be rebuilt, and you are committing to maintaining the implants. Even if you smoke, even if you have diabetes, even if you're on certain medications or you have bone loss, the answer is not no. Your treatment may need to be modified, like I said. You may need clearance, we may need additional procedures, healing time, whatever it is. But the only way to know for sure is through a complete consultation with us. We begin by discussing what is bothering you. Are you missing one tooth? Are you missing many teeth? Are your teeth constantly breaking? Are you tired of a denture? Do you want something removable? Are you looking for something fixed? Then we examine your teeth, your gums, we review your medical history entirely. Then we take a 3D scan, evaluate your bone, and determine which options are the best for you and for the best long-term result. Two patients can walk into this office right now with what appear to be the same problem, but they need completely different treatment plans. You can determine whether you're a good implant candidate based on your age, a photograph of your smile, or something that you read online, okay? You should also not assume that you are not a candidate because someone told you 10 years ago that you're not. Implants, imaging, technology, surgical techniques continue to improve. That does not mean that every patient can receive every treatment, like I said, but there may be more and more options than you actually realize. So, if you've been considering dental implants but you're unsure whether you qualify, the next step is very, very simple. Reach out to our office, click below, We'll evaluate you, we'll evaluate everything, we'll explain the options that are available to you, the challenges that I see, and what would need to happen to make implant treatment as safe and as predictable as possible for you. Even if you are only researching right now, that's completely fine. The goal of the consultation is to give you information about your mouth so you can stop guessing and just make a decision with confidence. Until then, I'll see you in the next one.